2016-17. Obesity in Wales is worse than any other in the UK nation. 59% of adults are considered overweight, and 26% of children starting primary school are classed as obese or overweight. What steps are the Welsh Government taking to tackle child obesity in Wales, and in particular the economically deprived regions of Wales, such as my own region, South Wales West?
We have a range of measures in place already. For example, the Healthy Schools Network, the 10 Steps to a Healthy Weight, and indeed the Daily Mile, introduced by my Minister of Corridor, Rebecca Evans, when she was the Public Health Minister. There are a range of things we're already doing to undertake both greater physical activity, greater awareness of health behaviour, including diet, of course, but we're looking also to the obesity strategy, which this Assembly passed as part of the Public Health Act, and I'm looking forward to, before the summer, reporting back formally to this place on the steps we're taking to take forward a consultation on the future of that strategy.
Thank you for that answer, Cabinet Secretary. Troubling research undertaken by the University of Southampton has shown that only 15% of schools provide 2 hours of physical exercise each week for 7 to 11-year-olds. And it is felt that Welsh Government should engage with schools, nutritionists and parents to reverse the increase in child obesity. And this engagement is the key to maybe solving the obesity crisis in Wales.
But there are a range of measures here, and actually when we think about the challenges that we face, this is part of the common challenges we face in a range of public health outcomes. Smoking, alcohol intake, diet and exercise, and in particular diet and exercise when it refers to obesity, but also alcohol as well. And the role of schools, it isn't just about the children when they're in school, of course. That is a significant part, which is why I'm really pleased to be continuing to work with my Cabinet colleague, the Education Secretary, on Cabinet reform and the health and wellbeing domain about behaviour we want children to take on board whilst they're at school. But there's actually a broader point about the family and the community that children live in, and what are expected behaviours within that family and the choices people make, as well, of course, as encouraging people to alter the way in which they provide food as well. So steps that have already been taken, for example, to reduce sugar content in drinks are to be welcomed. There are more steps that I'd like to see food manufacturers undertake, thinking about the fat content and other issues too. But we can't simply see it as one part of it. That's where we see the child in their context, the family in their context, and our obesity strategy need to think carefully about how we address each of those things, what the levers the government has available to us, and the partners we need to work with to make a real difference for public health now and in the future.
Thank you for that answer, Cabinet Secretary. It's positive to hear that family engagement is a priority for you, and I'd like you to also look at exploring avenues of increasing the range of extracurricular activities. I appreciate the Welsh Government has been working in this area. 48% of school pupils in years 3 to 11 in Wales are taking part in organised physical activity. I wish to highlight Wales' success in the Commonwealth Games. We must encourage all children to be as active as they can and encourage children who excel at sport at the same time. So what is the Welsh Government doing to encourage the 52% of children who do not participate in any physical activity, but whilst at the same time encouraging and assisting the local sports clubs who are struggling financially, along with individuals who have a talent but lack the necessary funding to excel in their sport? Thank you.
I'll try and deal with 3 particular points there. On organised sport, whether it's elite sport and the role it can have as both role models, not just in terms of a media profile, but actively going and engaging within their community, and its role and link to community sport. Work that I did previously with Rebecca Evans when she was a Public Health Minister, work that I'm looking to repeat and undertake with my ministerial colleague David Ellis-Thomas, and look at the continued contribution of organised sport to broader physical activity the role that governing bodies have to play, the role that significant and elite sporting organisations have to play in promoting community engagement is part of what we're doing. That is organised as opposed to incidental. I'm looking forward to more information on that. In terms of physical activity, it is of course not just about activity within the school. It is about how people choose to live their lives and how we encourage and enable that and make it easier. That's why active travel is a particularly important part. It's to normalise walking or cycling to school and to normalise walking or cycling outside of trips to and from the school environment. It's also why we continue to fund activities like the summer holiday enrichment programme. Additional activity linked to physical activity, linked to learning within the school, and also, importantly, as I said at the start, linked to the proper engagement and the whole engagement of that whole family and making a real and lasting difference.
Question 3, Andrew Arty.
Question 3, Andrew Arty Davis.
Secretary make a statement on recruitment and retention